Yes.
Okay, so we are coming back to the basic because we have been talking about technology, we have been talking about brain mapping, we have been talking about a lot of things for mental condition. But our group with the University of Tel Aviv, which is now 55 researchers and academic people worldwide, is concentrating on VUCA PTSD. And we are talking about VUCA PTSD. So it's we come back to we started 3 years ago. We were 4, 5, are now over 50, and in 3 years, VUCA become more understood, and I would say, if not more understood, the effect of VUCA are more visible in everyday life. And we see some interesting things we see now with VUCA that can apply to different traumatic situations. So, new statistic. This shows on the left the problem of in a dollar in trillion actually trillion of dollars the problem of the different mental condition. And personality is an issue, OCD is an issue, but look when you start at PTSD here, and you go around with, because when you have PTSD, you have problem of sleep, you have substance abuse, you have the problem of substance, you have stress and burnout for sure, you have anxiety and depression later. Not everybody have depression, but it comes for different reasons. That is worldwide. Now on the right side, you have Israel. And you can see that in Israel, we are above all the average of every country. And when you look at, for example, PTSD, you can see how huge is the difference in Israel with PTSD. And VUCA is a form of PTSD. Very interestingly, we can even say that VUCA is an enhancer to PTSD. It increases the situation. So to call VUCA PTSD is true, but not totally true, because PTSD is post-traumatic stress syndrome. And we are still in a traumatic, stressing situation. And that started with COVID. So this method, which is a 6C, is a protocol used for PTSD to minimize the effect of PTSD, have been done by our colleague Dr. Moshe Farshi, which soon will join us. And this is a model for first aid, because depending on the way we talk to the person, it can create a PTSD. So we need to have a cognitive conversation and not a limbic conversation, which is emotional. So we need to ask questions to the people, making them to do a choice or the decision. So that brings to a very interesting remark, because VUCA is a cognitive problem. Because before the Cuba missile crisis, there was not the news, there was not the TV, and nobody had that problem. There was stress in life. But it was not the same way, which when VUCA name have been created by the Academy of War in America. And it was VUCA. It became later VUCAH because of what happened during COVID. So if you take the relation between how does how it move from a trauma, a PTSD, for example, you have then hypervigilance, anxiety hypervigilance, it disturbs the sleep. And the sleep trigger depression and exhaustion. So if you remember now the map we had, when you look at VUCA, we in fact cover 85% of the symptoms that we have in general in psychological issue. But it's very interesting because on common to all the problem we have looked, all the clients, everybody, they have a problem of sleep. So sleep is something that we need to address for all of the conditions. So, for example, we started to see PTSD trauma, and we can start to see how we can use, and we will go deeper in the presentation, we can use some iconic communication to visualize, but what we do is we lower arousal for better regulation. For anxiety, we want awareness on sleep problem. And then if we do a good job, we have a better sleep and rest rumination. That's for the sleep. It also helps to have better choice, less impulsive reaction. And for depression, we want to develop agency, and this gives higher agency, reduce downstream burden. It's a very good representation to show that there is different steps which will address the different cognitive way to get a different outcome. So VUCA, VUCA is volatility, uncertainty, complexity, ambiguity, hyperconnectivity, but it's an environmental condition. And it's destabilize and interfere with human cognition. By consequence, emotion and decision making. But VUCA is a cognitive disturbance, and it's a societal disturbance. So, volatility, rapid and predictable change in speed, magnitude, direction. Psychological impact create hyperreactivity, drive anxiety and urgency, reduce ability to plan. That's what does that one. And by the way, each one is a pandemic because they come together, they are endemic. Example, sudden escalation of conflict, economic crash, rapid policy change. That create a psychological condition. Brain response, fight, flight, freeze, it's an hormonal reaction. It's a totally hormonal reaction, and we can even say from the whole brain, because we are mammalian. But it's a physiological response to a psychological stress. Again, it's cognitive. Uncertainty. Definition is lack of predictability, inability to forecast outcome. Psychological impact, generate worry, rumination. Weaken confidence and commitment. Increase cognitive load. Example, not knowing what will happen next, lack of reliable information, difficulty to plan ahead. Brain response, constant scanning, overthinking. So you see that each one have a different effect on the brain. Complexity. Definition, multiple interconnected variables and dependency. Psychological impact leads to cognitive overload, reduce clarity of cause and effect, impair decision making. Example, multi-stakeholder system, health, economic, and social crisis combined, brain response, paralysis or oversimplification. Ambiguity. Ambiguity is a lack of clarity about meaning, interpretation, and reality. It's a little bit like when you get the news, and there is a good news, a bad news, and in half an hour, you don't know which news is what. That's the ambiguity. And on the top of it, when you look at the news, we'll come to hyperconnectivity, but the ambiguity is such that depending on the news outlet that you are using, you get different information. And during the day, you get conflicting information because nobody knows what's going on really. So its psychological impact is cause misinterpretation or lead to wrong decision and increase emotional reactivity. Example, conflicting report, mixed signal from leadership, government, or even in an argumentation with a spouse. There is a lot of ambiguity in the in the family discussion. Brain response, guessing instead of knowing. That is a very important one because people guess, and because they are stressed and because they don't sleep well, they guess automatically the worst. They don't guess the good. And that's the problem of the down spiral. Hyperconnectivity, constant excessive exposure to information signals direction. Psychological impact, attention fragmentation, emotional contagion, fear spread fast. It goes very, very quick. Actually, you see something going in the Detroit of Hormuz, and suddenly the price of everything, stock exchange is affected. Reduce deep thinking capacity, overload of information driving to distrust of new and nocebo culture. Nocebo culture is an interesting new thing. Before, in all the study, we were looking at the placebo effect. Now we are not in placebo effect. People don't believe it works because they have doubt. So they are in nocebo effect. On the nocebo effect, it's very difficult to help somebody to get better when he is in a nocebo culture because he don't believe in it. So we need to move step by step to show them they can improve. Example, social media overload, 24/7 news cycle, continuous alert, dependence on like. That's the dependence of TikTok on the social media. Many, particularly the young generation, they don't have a normal life. Their appreciation of life and value, their value, is the number of likes they get. And if they don't get the like, they get depressed, which is not a realistic way to look at life. And it's difficult to have social integration. Brain response, distracted, reactive, fatigue. All that makes that the people wake up more tired than when they go to bed. And who is affected by VUCA? The whole world. The whole world since COVID, because everybody was contained, everybody has got the trauma, the maybe I will die, I cannot get out. The lockdown was a very terrible psychological effect. And then they spend their time on the computer, on the screen, on this, on that. But we can trace, for example, if you look in older adults with mental decline, you can see that the quantity goes up since exactly when started COVID. So we have a lot in VUCA. VUCA have been, in fact, like an accelerator putting on steroids the VUCA situation. And what do we see? We see this is for mental decline, but it's quite valid for many things. The biggest trigger is hyperconnectivity. For example, here in Israel, looking at the news is the best way to be very nervous. And by the way, all the alerts come here with a cell phone by WhatsApp. Uncertainty, 25%, and complexity. So you see the three first one, okay, are already 85%. Ambiguity, it's difficult to deal with. Volatility, it's different. But the three first one are the bigger factor. So integrated effect of VUCA, when we integrate the different elements, is the perfect storm of the brain. Stage 1, external environment. VUCA element, volatility, uncertainty, complexity, and you see what it does on the human system. Emotional spike, fear, urgency, worry, doubt, loss of confidence, cognitive overload, misinterpretation, attention fragmentation. It's a very, very psychologically challenged society nowadays. And the numbers are huge. And the projection by 2030 is the figure we have of 1.3 trillion in mental health will jump to 2.8. EBA disruption, EBA is emotion, belief, action. So you see that emotion is dysregulated, belief is distorted, I cannot cope, I don't control, and action is impaired. So it's an avoidance, impulsivity, paralysis. So when you lose EBA, you lose external locus of control, learn helplessness, reduce decision quality, loss of commitment. We will see later how we can bring it back. Stage 4, low resilience, poor recovery from stress, increased vulnerability to PTSD, depression, burnout, functional decline, particularly with older people. So VUCA is disrupt emotion, belief, action, erodes agency, reduce resilience. The approach we will give you today, restore regulation, clarity, and choice, rebuilding agency and enabling resilience. Again, it's a cognitive approach for a cognitive distortion. Phase 1, VUCA exposure, what level of volatility or uncertainty or overload the person have. We need to understand that. Emotional state, are they anxious, stress, hyperarousal? Agency level, are they in an external locus of control? I cannot decide, my life is depend on things outside, or internal locus of control. And then response pattern, what do they do? Do they have any avoidance? Are they in impulsivity or are they paralyzed, which is a flight freeze? Phase 2, regulation, that's the first priority. We need to stabilize the nervous system. Tool, breathing, hold your breath, because by holding your breath, it's a decision, it's a cognitive process, and you tell the brain, I am in control. The fact you choose to control your breath, you hold the breath, is a message to tell to the brain, you are not in flight freeze, you are in control. Vagus nerve, working on the vagus nerve by any means we can, and to stay calm, that's the goal. Outcome, reduce arousal, restore physiological baseline. Awareness. We want to move from reaction to observation. We want to avoid reaction. We want to make decision. So the tools are recognition, awareness, here and now. Because only on here and now you can have an impact. And I see what is happening, and I can separate from emotional flooding. I have chosen those icons to show you that with the icon, we can give a better view of what is going on. And we have many different tests showing that the icon people can memorize when words people forget and they can get overwhelmed. So we start to see, and we have different studies showing that using iconic representation as a dialogue in therapy or in coaching help people to understand what it is, and it's a very good tool. We see extraordinary results with neurodivergent. So goal, correct distorted belief. Evoke tool, thought process, first and second thought. First thought is always a reaction. It's always something which is automatic in the brain. So we want to move when we move in the mind and decide, do we act on that emotion? Do we react or not? Fear versus anxiety. Anxiety is virtual, fear exists. Outcome, replace catastrophic thinking, restore clarity. Decision and action. We want to restore agency. Tool, choice. The choice is binary because more than a human mind, cannot choose more than one choice out of two possibilities. When we try to put more, it creates flight freeze. It creates hesitation. So we want to go and teach people binary. Is it safe or not safe? I want to be outside or inside. Is it good, not good? Does that bring me to my destination or not? So by binary thinking, we remove everything which is in the middle, which is a gray zone. This or not, because in binary reasoning, it's not this or that. Is this or not? I react or I don't react. If I react, Is it this or is it that? And think things through. Think about the consequence, what you will say, what you will do. So outcome, intentional action, reduce impulsivity. 6, reconstruction, the goal is agency. So we build internal locus of control by destination, and by you end up where you look, because that's what we prove at Carnegie Mellon, that people always end up where they look, and they don't look with their eyes. They look with their mind. What are you looking? And that's where you end up. So outcome, direction, and commitment. Consolidation, resilience, because resilience is a process of consolidation. It is a process, a learned process. So we want to make it sustainable. Self-assessment, 4th step, to look at things as a process. And we look at the process because nothing comes in one shot. And it's a process of rehabilitation. It's a process of resilience. So outcome, learning loop, long-term resilience. Clinical summary, treating VUCA is not treating symptoms. It is rebuilding the decision system. And decision system is cognitive. So you see that we need to touch cognitive things, and that means metacognition, to treat the emotion by metacognition tool. Therefore, many technology doing things on people need to educate them on what is the outcome, what they can expect, what they will see, because if not, they don't know. Protocol in one line: regulate, observe, refrain, choose, act, reinforce. So now we go in the treating VUCA exposure. We make an assessment, VUCA exposure, what level volatility, uncertainty, overload. We have a test for that, by the way. Emotional state, anxiety, stress, hyperarousal. Agency level, internal versus external locus of control. That could be some dimension of the life of people that they feel is not in their control, but they can think some other dimension of their life in their control. But normally, most of the case, when you don't feel in control, it's bleed in other area of life. So we need to respond pattern, which is avoidance, impulsivity, or paralysis. Regulation, first priority, stabilize the nervous system. Breathing, hold the breath, vagus nerve, keep calm. So we reduce arousal, we restore physiological baseline. It's very important, and this is also cognitive, because we can have a cognitive intervention for the breathing. So the more the people we develop a cognitive process, the more they become an expert to help themselves. Awareness, move from reaction to observation. So we have the tool recognition, awareness, here and now. Outcome, I see what is happening, and it's a separation from emotional flooding. Cognitive reset, thought process, first, second thought, fear, anxiety. Outcome, replace catastrophic thinking, restore clarity. Decision action, restore agency. That's the big one. So we want intentional action and reduce impulsivity. Reconstruction agency, we build internal locus of control, and we want to give them direction and commitment. Commitment is very important because we help them, and that's something we have seen in Israel. For many people with PTSD, I ask them, what will you do differently when the war will be over? At the moment we ask them, we bring them on the destination, they automatically think the war is over, it will be over. When it's over, I can do this, I can do that. And they feel a survivor instead to feel a victim. What we want to do is to make them feel cognitively that they are a survivor because they have an internal locus of control instead of being a victim. And that's very important from the get-go. consolidation resilience, self-assessment, learning the loop, long-term resilience. Summary. Treating VUCA is not treating symptom, rebuild the decision system, but the protocol regulate, observe, reframe, choose, act, reinforce. Clinical handbook. Question, are you feeling overwhelmed or uncertain? Do you feel in control of your decision? Are you reacting or choosing? Classified in high VUCA exposure, moderate or stable. Regulation, calm the nervous system. 4-6 breathing cycle, because when we do, by the way, 4-6 thinking break, it's per minute. So per minute 4-6 breaths, because that brings the person in alpha. So we can control the brain wave by the breathing. Pause before reacting, hold. The pause is very important before, it's more than reacting, it's before exhale, because you hold and it gives a message of I am in control, everything is fine. On grounding, the sensory reset. So shift will be on the heart rate and emotional intensity. Awareness, script, what is happening to me right now? Where I am, where am I? So label emotion, identify trigger, distinguish fact versus interpretation. Many times there is a confusion between the fact and the interpretation. Outcome from I am anxious to I notice anxiety, and it's a different situation. Cognitive reset, goal, correct distorted belief, protocol, identification of automatic thought. This is the reaction. This is the way normally I react, but we can teach them to do it in a different way by a second thought. The first thought is in the brain, the second thought is in the mind. It's basically after 180 milliseconds, after 360 milliseconds, the last 100 milliseconds of the model. Example, I can handle this. This is difficult, but I can respond step by step. That's why it's a process, because we teach them to break it in small pieces. Decision restoration, we rebuild agency, red door, green door. Red door is where we have problem. It gives us anxiety just to look inside the door. We don't look, we look for the green door. We have a binary system, and by this way, you end up following green door after green door, you end up to your destination. Ask, what is the reactive option, red? What is intentional option, green? Because it's a choice. So people need to choose conscientiously. Again, cognitive, not emotional. Action. Rule, small, immediate, intentional action. Little step by little step. When the people see they can have an action, they have a choice, it helps them. So we can send them a message. Sometimes I send that to my patient. They can take one step task, and you set boundary. That helps. So step 6, agency building. We reinforce, I choose this, I act despite difficulty. This is agency. When we restore agency, we have automatically restore internal locus of control, and we have automatically help the people to make the right choice and with a good awareness. The resilience group is daily practice. What did I face? What did I choose? What worked? Because humans can improve, but they can only improve if you develop the cognition system. And if there is no cognition and we are in the reactive automatic system, the reactive automatic system, being emotional automatic, does not bring any intelligence, does not bring a choice, does not bring a logic, does not engage in prefrontal cortex. The whole thing here is engaging the prefrontal cortex, knowing what is happening. In regard of where do we want to be, what is the destination, what is the goal? Clinical formula, regulate, observe, refrain, choose, act, reinforce. So if you look at what we do, and we come back to the first big round circle with all the conditions, we go from anxiety to calm presence, depression to energy, stress to balance, sleep debt to restoration, substance abuse to freedom, and trauma to safety. Why we do that? But we don't work on that process on ADHD or OCD. This is something little bit different. Of course, ADHD and OCD being comorbid, they are aggravating factor. But it's another story for another day. Okay, question, discussion. That's the time where we open the floor to everybody. Who wants to start? Coty.
You said that you ask, yes, we have a questionnaire. That's what you did just now, right?
Question on how do you do in your own practice or in what we do concerning those elements of VUCA.
So my question is, because we can see, we can feel the reality by our own filters, that in someone that is under distress, those filters are not so objective. How much can you trust their answers?
So this is what I will call, we are confronted to that every day. And I will give you a way that I am doing it, and we are talking with different colleagues. We have found that they get, in fact, what do they have? A bad habit. They have bad habit. So their process of thinking is skewed. So it's like to tell somebody, think outside the box. Well, they cannot think outside the box when they have their feet in the box. Okay? So we have found that we need to take them somewhere they don't know, something new, something they have not been involved with. And I treat a lot of patients which have been for 6 years, 5 years, with other psychologists or psychiatric doctors. And I discuss with them, I use the icon, not as therapy, as a tool of conversation. And then they focus on the icon. And instead of thinking about, I had this, I think that way, the icon is made to bring something new in their reasoning. And we only speak about the icon. And the icon helps us to take them to look at a different way. Because so that's very important for that, is the difference between emotion and feeling. Emotion comes very, very quick. It's not even 100 milliseconds, 100 of a millisecond. It's in the brain. It's hardwired. And that's the automatism they have. So that's certainly not the way we want. But the feeling comes after the thought. You have thought, then we integrated in our model attitude, I'm sorry. An attitude is something that we repeat, positive or negative, okay? But we teach them a positive attitude in dealing with that issue. And if you change the way people think, it will change the way they feel, and it will change the way they act. Now, to do that, little secret, we go backward design, because we start by the end. And we don't talk about their problem. We talk about the outcome we want to do. And we only concentrate on that. So yes, first intervention, I listen to them. because I want to know where is the bottleneck. But after 20 minutes, I say, okay, now I understand. You have got this, there is this happen. I feel your pain, I know, huh? But I am not here to talk about your pain. I am not here to give you a pill to get better. I am not here to stop your pain like with a pill. I am here to get you to do things differently that you have done so far. Because what you have done so far, the way you think, the way you act, is bringing you where you are here today. So if we want, so tell me the outcome you want. And we start by thinking of the destination. And I have found in Israel, I start by looking at the time of the problem. It could have been when they were a child, or when they have been raped, or when they have been this. But we go from there and we say, okay, that was in the past, and that's another card number 28. The past does not condition your future. And we show them that card, which is very visual. And you see that person was like that, now he's like that. You can change. It's the same with you. You need to learn a different way of thinking, and that thinking has to be applied to what do you want to achieve. And what do you want to achieve? You want to to be happy, you want to do art, you want to do this, but when you speak about a better future, which is when they get better, they engage. And I have found people which are in deep depression, in deep, very bad obsession. But if you only fix on that, they will tell you what they would like. And then I use a second tool, which is the magic wand. Don't worry, it's not a matter of money, it's not a matter of this, no, no. If I give you a magic wand, what do you want to see as an outcome? And yeah, we have to work a little bit on that. Because most of the time, they give you first a laundry list. I want this, I want that, I want a car, I want a beautiful house. No, okay. But all those things are things you can buy. They are not things you can achieve by yourself. So tell me about things you can work on. And then we tell them, look, uh, they can tell you, like a picture, what they see around. I see the children, I see the family happy, I see, So then come a trick. You're asking me professional trick here. Do you see yourself? Well, I see the other people. They don't see themselves. They are not in the picture. They can see the people happy, but they don't see themselves happy. So session number 2, work on it. I would like you to make me a picture and to depict me how you look, how you are in that picture. Now they get in the picture. So you see, I started by thinking out of the box. To think out of the box, you need to be out of the box from far away, which is the backward design. Let's start by the end. And if you stick to that, you don't let them take you in the narrative of my problem on this and that. If you stick to that, but you stick to that very easily with a card. Because trust me, for 45 minutes, you will use what? 5, 6, 7 cards. That's all. But those cards keep the conversation. And guess what? At the end of that session, they have not been thinking about their problem. And at the end of that session, you show them something. They can forget about their problem for a little time. That is the seed. And then you teach them making a decision. Today I will spend 5 minutes on that. Today I will do a PBM. Today I will put something on to help my gut, whatever. And they do it. But we have found that the most important element is keeping log of what they do. We want them to document their journey in progress. Progressing, keeping log of the progress shows them a mean data. It's clear. I have done this, I have done that. If you did it one time, you can do it again. So you can do it again. But you don't want to make it complicated. So now we have down, I know, Coty, you have been trained at the Evoque system when it was 90 cards. Now it's only 15. We have only 15 cards. 5 cards for what is your destination. 5 cards for what is your awareness. 5 cards for this is a choice. Once you have done that, you have rebuilt agency. Every person who goes through that have rebuilt agency. And then you can do more cards or different things. But we have shift to 2 different ways. One is, we call it the winning game with only 15 cards, 3-step, backward design, destination, um, awareness, where I am, what is my strength, what is my weakness. But that's already coaching or therapy. For VUCA, we don't need necessarily all that. We just need to to work on each element. We don't need everything. We need to fix on what do we want to change in their perception. What do we want to bring in a cognitive way? Again, cognitive way. Because we can have their cognition and then they realize that it does not trigger or engage their emotion. And it cannot be both. You are either in the limbic system or you are in the cognitive system. It's not both. So we only engage in cognitive because VUCA is a cognitive distortion. But it applies to most of the other conditions I show you on the round things at the beginning, and it's 85% of the case. And it will, if you can cover already 85% of the case by few images, I'm talking about 10, 15, and that's all you need to do. Image which helps them to move on every element of VUCA. And they feel better. After normally first session, they start to sleep better. Did you sleep better? Yes, I sleep better. Ah, what's the difference? Because we have removed anxiety and we have removed one element, self-helpness. Learn helplessness is really what discourages them. So we show them there is a possibility, there is a way. And then they do it more. But I never see a client more than 6 times. All my clients, by the way, I tell them, I say, I will not see you 7 times. I will see you 6 times. That means you need to work in between sessions. I send them the video. I'm sorry to speak about me, but you're asking me question, I answer. I send them the video. I send them exercise. You need to do this during the week. Because if there is no exercise, they forget about it. So it's really simple work, repetitive work, but repetitive work triggered by the image. So, you know Salome, we had, by the way, a study done at Duquesne University in Pittsburgh with the kids in the school, which is a very difficult school. And the kids now are thinking in terms of icon. And they know how to keep calm, and they know how to do that. So we already have a study, but Salome is working on a second thing. She's comparing the concept with the icon. So she have a group of 60 people she teach with only regular psychology with word, and 60 people that she's doing with the icon. And it's very interesting because she came up with a conclusion that the same way you have PNL, which is programmation,
It's a neuro-linguistic
neuro-linguistic
programming.
programmation.
Mhm.
Neuro-linguistic programmation. We have found that with the icon, we are doing iconic reprogrammation. But we only use the card. Is the big difference with the time you have been trained, Coty. We don't dip in the card. We don't teach the system. We don't teach anything. It's a library of psychological situation that we use with the client. It becomes a tool to open the conversation, but we stick to that conversation. Other question?
Uh,
Yes.
well, I'm just understanding this, but so the principle is that you have the cards that you use, you assess the person, then you decide where they're at and give them like 5 cards in a session, which is a talk session.
I
That's an
don't, I
hour.
don't, I don't assess them. I will show you something else. Share. I will show you something else. This goes down. It's this, for example. Step one, you have destination. What do I want? And I am not talking about their problem. What do I
No,
want?
but this is like in a talk session that you have with, so someone comes, you're going to schedule 6 talk sessions and you do this in the first one.
We do in that session, we do that.
Right.
When we go in that order.
Okay.
And by the way, this has been done for the kid because the destination, we make it an image for the kid now. But the destination is a map for your life.
Right.
So you follow the map. We help them to make a map. That's all. So then after that, we go to focusing on the solution and not the problem. We show them that it's binary. We bring them in the beginning of binary, solution rather than problem. But we express that solution. Then we go to the second session, is where I am, and we want to know about the holistic approach, their eating
Yeah.
habit, their sleep, how they can improve. Many people don't keep a good hygiene of life.
But
Then
when,
we go, yes,
sorry to interrupt, but I'm just trying to get my head around how it goes. So a client comes in, you have an hour with them. Is it like once a week to do these cards? So you have an hour a week. So
they work in between.
so for example, things like even the first one, like if they don't know where they're going,
We help. That's what we do in the session. That's
yes,
what we achieve. We don't leave it open. We make sure they understand the icon. The icon,
yes. But to
not the.
kind of know your goal in life may take more than just one session. Maybe they have to do journaling. Maybe they have to think about a role. There's maybe.
If it's a complicated case, you need to go, then you will have 2 sessions, maybe for the destination. Okay? But if it's not complicated, these
Okay,
5 cards are done very easily, quickly.
I see. So then you go to the next, is it like weekly? And then the next week they're going to
Quickly,
focus on awareness.
yes.
And then
Those-
maybe they're looking at their body and realizing they're not eating properly. Do they then get like a diet? Do you suggest for them to eat better, or it's just bringing it to their
We,
awareness?
we, we explain them, do you do any activities? Do you
Yeah,
take care of yourself? You don't sleep well. What do you do to sleep better? Maybe you should try this. Maybe you should try that.
I
That's
see.
where we advise them an improvement, which could be an electronic system or anything else to
I see.
improve their health and wellness. Okay? But health and wellness, if you don't think about taking your key to go to the gym, you will not go to the gym. If you don't write on your day, I want to go to the gym and I will go to the gym and I commit, I will start to go for 10 minutes. But that's already a system where you have definitely started to engage them in exactly what you have here, which is agency. They have made, you want to make them choice. You want to make them a choice, even minimal.
Yes, yeah, I understand. I'm just wondering in between each like session, what kind of homework?
So we give them, I will explain you that off maybe another moment, because this is specific to your interest, and we'll take it at a personal at another moment. But we have exercise, we have video, we have different things.
I see. Okay. Okay. I
And
see.
then what do I change? So we have now, and
Sorry.
you see they are from where they were to they
Yeah.
learn to let go of their concern, let go of their problem, let go because they see that here, now they understand that they were prisoner of their own thought or obsession.
Yes. Yes. Yeah. I see. I see.
And if you, during a session, you make them feel better,
I see.
they know they can do it. And we have different systems. We are working, we have online system, we have many different things.
Okay. Got it. Thank you. Thank you.
Okay, so I was showing that for Coty, and you see this is more manualized. So many things have improved, Coty. What do you think?
I see many things changes. Yeah, but
I,
in a good way, in a good way.
I will even show you something else.
You know, Abraham, that I was working with acupuncture, and usually we think that the most needles you use, you are a better acupuncturist, but it's the opposite. The best one is the one that use one or two needles. So
Yes.
I think it's the same with this.
So that tool you don't know. For example, you speak about here now to a client. Okay. You go on this one. Look on this. You click here and you copy. And you put it on the email or you on the whatever. It takes fraction of second. And here is a sound. So they can, some people do better with the sound, you see?
Yeah. Yeah.
Happen in the future. It's staying in the moment and making it count. Life happens in the present moment, and that's where our choices make.
So a lot of things have changed since. Okay, let's
And
continue.
improved.
Any question, Anna?
Yeah, the only question would be, I have the previous version, if we can have this new version that you just showed.
Okay, we'll talk.
Okay. Thank you.
That version is very proprietary. It's my version, and it's for the people who commit to use the method. So you need to
We'll talk.
commit to make the method. Ali, any question? I am sure
No question.
I'm sure you have ideas about AI on how we can use what we have seen today for VUCA and how we can integrate. But by the way, on the tool you are developing, we could also measure the VUCA effect.
Yes, definitely. And
I
it
think
would be easy to play the cards and videos and everything over there as well.
on Caesarea, but the cards are made, the people are not made for people to say, I understand that.
Yeah.
And we have tested it on many people. We don't want that. We don't want them to feel associated to that because then they don't go to the message. The card is, in fact, very interesting. The card helps to remember the word,
Yeah, we can
the concept.
we can get some biometrics data and facial analysis and voice analysis to understand their reactions to the card and questions.
And we have many people we are training, and we have 100 people, 120 people in Georgia. And I have a course on resilience and VUCA in a VUCA world. And last semester, I was teaching to HR people, which will become certified as a chief resilience officer in their company. And now this semester, I have people who are in governmental policy, local and national policy. So we are going at that level. So between universities and what we do on those levels, people start to think. But the point of today is not to talk about what I do. It's not what I wanted to do. What I wanted to show is VUCA. I think the PowerPoint, and it will be on the website, the PowerPoint explained in a simple way VUCA. And we wanted to show that VUCA, you chop it element by element, by little piece, but it's not unsurmountable. But there is not a single person today in the world, if he have a TV or if he have a computer, who does not have a VUCA. You have a degree of VUCA. You might be more susceptible to this or susceptible to that. We have a test, by the way. We have tested on 500 people in the clinic in Lincoln, Nebraska. And we have found that the tools show us which of the elements the people are more sensitive. And it's not everybody. For sure, the biggest trigger is uncertainty, because uncertainty triggers always anxiety. Now, take any one of them, take also OCD, take also whatever you want. It's always a problem of sleep. On the first element, we need to help them to sleep better. And I am pretty sure that Sarah have an idea about how to help them to sleep better.
Yes, for sure, I do. Yeah, that's what I was going to say about the physiology. I'm so sorry, Dr. Mayer. I've got to jump now because I have a meeting I couldn't shift at 6. But thank you. I will definitely follow up. And it was lovely to see everybody on the call.
Thank
you,
you.
Sarah.
Thank you. Thank you for sharing. Thank you
Thank
so
you.
much.
Okay.
Thank you.
Thank you. Any question? Anybody have any question? No?
Thank you for sharing. It was very, very good.
Okay, so we will have a meeting with everybody to try to know when do we have, what day is better for, you don't see my screen. Need to do that. I need to do that. Share screen. Share screen. Voilà. We are working to know when should we have the meeting, because we have realized that some people have conflict. So we are going to make a census to try to know what day, what time is better for everybody. So we are going to make a census, but we want to engage more and to learn from different people. What do they do? How do they integrate the dimension of VUCA to look at the problem of their patient? Because many things are not because of the patient. The society is broken. The society is disturbing the mental peace of the people. And that's what we need to